My name is Dr. Leanette Henagan, and I am the owner and CEO of Concierge Wellness and Consulting. So pre-pandemic, I was kind of working in a hospital setting as well as doing private practice in therapy and counseling. I was seeing patients in person pre-pandemic, and then of course, as we know, everything changed after that. So the pandemic affected me personally pretty dramatically. As I said, I was working in a hospital and working and doing therapy, and as we know, the school shut down. I'm a single parent, so instantaneously I'm home with my daughter, and I'm becoming also a homeschool teacher while trying to be a therapist. I did work with patients with COVID during this time. Prior to me leaving the hospital setting that I was working in, there was a COVID floor. Exposure was an absolute concern for me. As I previously said, I'm a single parent, so working in a setting where I'm the biggest threat to my daughter coming home, I was doing all the protocols as any other medical professional would do. And at the time, we didn't know what the effects would be. So it was a huge concern for me. The resources that I use to deal with stress, I found a new support system. So there were other parents at my daughter's school that, we're all in this together. We are trying to figure out how to homeschool, and some of us were working. So we created our own micro, classroom is what they're calling it. And so different parents at different times, we were able to come together and still not be so isolated. I don't feel that we will ever go back to the old way of normal. I think that we just have to be flexible with the new normal. Change is good in some things we don't need to go back to. But I think embracing technology and Zoom, as a therapist, I have a greater touch. I can reach people in rural areas that I could never reach before. People that are handicapped or disabled that can't get out of the house, they can have contact now in a different way with a therapist. So I think some stuff we should embrace and move forward in. So I think all that stuff is good. I hope for normalcy that the kids can stay in school. I think that's for their mental health, because there's a whole component of mental health for children. They need that socialization and they need that touch. One of the community can do lets me know companies, PCP offices, different organizations are more in tune that mental health is important, it does matter, and that their employees need that. So they can help if they're doing that, if they're thinking about that, call me up and I can help get their platform on the behavioral health side up and running so they can offer those services to their employees, so their employees are happy and healthy, and then they're going to get greater production out of their employees.